Hey guys, so for this video I wanted to show you our two types of staples. One is this one that you probably have seen before, and this is just your typical skin stapler. And this one is a little bit fancy. It's called an Insorb and it looks like that. So the main difference between these two is that this device actually staples from the inside of the skin. You can't see the staples at all. So when you do a fan and steel incision for C-section, you're not gonna see the staples, and the staples aren't even silver, they're white and they go inside the skin, and I think that's pretty cool. And then on top of that, you use Mastisol and Steri-strips to finish the dressing, right? And then this one is your regular staples. They go above your skin, like a staple that grabs it like that. And they're not the prettiest staples, but it does the job, I'll tell you that. So I think the main difference with these two is that one is inside and one is outside. Now this one sounds like it's the best invention ever, but if you think about it, since the staples are inside, if you're coughing or having regurgitation or some type of abdominal pressure and you are putting a lot of pressure in your incision, they might pop off. And that is what I heard from the surgeons here. That's why I asked them why they don't use this versus this. And they said because this one you have a higher chance of getting the staples out when you are sneezing or whatever. So, at first I thought, wow, like this is probably the best invention ever, because you're not gonna have any scars and it's gonna look really pretty and it's gonna blend in with your skin and very minimal visibility of scars. And then you go to this one, and this one you will definitely get some scars on this one for sure, because out of all the surgeries I have done, the people that have used this, when they come back for another surgery or another C-section, the holes that holds the skin together, they stay there. And for some reason, I guess it depends on the skin too. And some people scar better and some people scar worse. But this one, you actually have to go back to the doctors to get the staples out. And then, I don't think they're going to do that under local either. They're just going to just snip it out, because they have this skin staple remover that they have for this device. So this one, you don't take these off. They stay in there and they don't need to be taken off. I think they're absorbable. So there's definitely pros and cons in this, and to be honest, I don't know what I would prefer. For this one, I just don't like to have a scar or a risk of getting a scar, so I'm probably not gonna go with this. I'm probably gonna go with this one and just control your reflex and things. But other than that, I want to know which one you guys would prefer. This doesn't usually work on orthopedic. This is the most used in orthopedic because the skin there in the legs is very tough, so we need something that could really hold. So there's benefits of this and cons, and I just want to know what you guys prefer using, or if you know anybody that has used this but didn't get scars, or used this one and did get scars, because I always see patients with this type of staples and I see a bunch of little holes around their incision, and it's not cute. It's not really pretty. But with this one, it looks so perfect. So I want to know your thoughts and concerns. Please send them down below and let me know. Thank you.